Go live.
You're watching Eyewitness, the Prince daily live feature covering the coronavirus pandemic. I'm Jyoti Malhotra in Delhi, and today I have with me Bismi Taskin, who is on the highway, on the expressway actually, on the way to Mathura. She has been traveling across Western Uttar Pradesh for the last several days, covering the COVID story. Bismi, welcome to Eyewitness. Tell me exactly where you are and what you have been doing these last few days.
Thank you, Jyoti. So we started our journey about 3-4 days back. We went all the way to Aligarh, and then today we were in Bulandshahr. So in Aligarh, we had actually gone to cover the story of the Aligarh Muslim University professors who succumbed to COVID-19 and suffering from post-COVID-19 complications. So what we found out there was that 16 out of the 18 professors there had not taken the vaccine shots. Only 2 of them had taken, and that too only the first dose, 3 days and 10 days before they got infected with the virus. So after covering AMU, we roamed around in Aligarh city because we had heard from a lot of doctors there that the people of Aligarh do not want to get vaccinated. Now, let me tell you, this vaccine hesitancy in Aligarh is not only the problem with Muslims like we have seen in other parts of Bihar and Uttar Pradesh.
Right.
In Aligarh, even in the city, so it's not only rural Aligarh where this problem is there, it's also in urban, in the main urban Aligarh, right next to the AMU campus, right next to the Jawaharlal Nehru Medical College, which is affiliated to the Aligarh Muslim University also. We found people on the roads flocking together without maintaining social distancing. Even the ambulance drivers do not wear masks there. So we also visited one of the most famous crematoriums in the city, the Murtidham crematorium there. So when we had gone there, we spoke to the people who cremate bodies. So we had met one Devendra Kumar and one Avdesh Kumar there, who have been doing this since the last 10, 20 years. So in spite of, and now this is really important and very shocking as well, because these guys have been dealing with COVID dead bodies as well. So this second wave itself, they have cremated around 50 to 60 bodies.
Okay.
And as a total from last year, it's 150.
Right.
So they told us that they do not believe in COVID.
Yeah. Bismi, just 1 second. First things first, I mean, thank you for describing this, but there are some questions that are coming in already for you.
Right.
So just, the first question is, when you were in Aligarh and you talked about vaccine hesitancy, both at the Aligarh Muslim University, and you pointed out that 16 of the 18 professors who had unfortunately passed away from COVID had not taken their shot. So you would imagine that people in such a reputed educational institute, educated people would not have this vaccine hesitancy. But what do you ascribe it to?
It's basically, so regarding AMU, first things first, it was also because of the month of Ramzan. So a lot of these professors had told, a lot of our sources in AMU had told that when their doctors had coaxed them that, take the jab, take the shot, they were like, ki roza toot jayega, Ramzan ke baad lagayenge. Now, another problem there was, now AMU is a Covaxin trial site. The vaccine, AMU's Jawaharlal Nehru Medical College itself is conducting Covaxin trials since last November.
I see.
So the discussion in the AMU campus is more about the efficacy of the trial data or the virus itself. So a lot of the professors, they thought that, if I take the vaccine, what if I die? What if I do not recover from the fever that I'll get after the next 24 hours? What if because of my comorbidities, I do not survive? Who will look after my family then? What about my children then? So there was a lot of hesitancy going on, and which is why they were like, no, we will only take the vaccine when there is 100% guarantee that, this is going to prevent us from COVID-19. Also, it was carelessness. It was a laid back approach. These people thought that the pandemic is over, but it was far from over, as we have all seen. They thought that there is no need for us to get vaccinated right now.
Yeah, but you would imagine, even though you're saying that AMU was a Covaxin sort of testing site, if you like, but even though you would still imagine that people who are working in a university, who have access to knowledge and who are sort of basically at the front line of education, that they would be able to think this through and at least speak to their fellow professors, fellow people who are scientists, and examine this and look at the whole evidence scientifically, rather than imagining that that they would get infected and they would not survive, and that the fever would have these these unforeseen consequences.
Yeah, so I spoke to a couple of doctors at JNMCH. So they, in fact, a lot of the professors who have died are academics. There's one who died, Shakil Samdani, who is the dean of faculty of law. So highly qualified people who read a lot. So this reading a lot is something that had gone wrong here, because the more they were reading, the more they were getting scared to take the vaccine, is what the doctors have told. In fact, one of the professors, whom I would not like to name here, because he has died and like his family wants to maintain it and to keep it anonymous,
Yeah.
he had got his wife vaccinated, because the UP government had notified that if you do not get vaccinated, we will not release the salary for the month of May. This is what his son has told me. So he got his wife vaccinated, and when the doctor at JMCH told, "Ki sir, aap bhi laga lijiye, you also should get the shot," he said that no, it's only for my wife, because otherwise she'll not get her salary. So a lot of these professors were very doubtful. They do not trust the vaccines. They think that I'll get clotting, there's something go wrong, like horribly with my body, whether it was for Covishield or it was for Covaxin, both. In fact, the Vice Chancellor made repeated appeals. A lot of the volunteers in the Covaxin trials in AMU, including the Vice Chancellor himself, had volunteered for it. In spite of that, these professors just did not want to get vaccinated.
Well, that sounds quite sort of remarkable to me, and I'm sure to a lot of viewers. So viewers, I would encourage you to send your questions over the next 15, 20 minutes. Vismi is with us. She's on the highway, as you know, going to Mathura to cover another story. So here's a question for you, Vismi. Sai Kiran Cheruku is asking about this exact subject, vaccine awareness. But he wants to know, is there a drive on behalf of the state government? Are people sort of going out and in places like AMU or even in the city otherwise, are they talking to them, whether it's sort of BJP MLAs, because the state has a lot of BJP MLAs, or even any other MLAs in AMU itself? What about say you talked about Ramzan? During the month of Ramzan, people didn't want to take the jab. What about Maulanas, Muftis? What kind of awareness is there?
So I'd spoken to a couple of Maulanas in AMU themselves. One of them had told me that who knows, COVID might just be a normal fever and flu that has been exaggerated. So it's not like they have been of much help in this case.
Mm-hmm.
So Aligarh as a city has been quite backward in terms of vaccination. Like I'll give you an example. I was talking about the Muktidan Samshan Ghat. Those people told me that COVID does not exist. Even after they have been cremating so many COVID dead bodies, they think that there's something that doctors do to these people, to these patients, when they go to hospitals. So now people do not even want to get tested there.
But who are these people you're talking to in the Shamshan Ghat?
So the people who cremate the COVID bodies, the people who have died of COVID, these guys, they cremate those bodies. They've been working in the Samshan Ghat for a very long time. So like I told you, they have cremated over 150 COVID positive dead bodies. People who have succumbed to the disease. In spite of that, they think that these people have died because they've gone to the hospital and doctors have done something wrong, and it's not the virus.
But then when these people pass away from COVID, then isn't there a special protocol in the handling and the treatment of the dead body?
Yes, absolutely. There is a protocol. It comes in a zipped bag. You cannot touch the body. You cannot come in contact with the body. You can see the face of the deceased person, but you cannot come in contact. They follow the protocols, but they do not agree to the fact that this is a virus that is, killing so many people. They think that people are dying because they are going to hospitals, because they are testing positive. In fact, a lot of the AMU professors, in fact, did not even contact doctors. They took up Procene and paracetamols and did self-treatment, and only got themselves admitted to the hospitals when their oxygen level fell below 80 or 75.
So both these people in the Shamshan Ghat as well as the Maulanas, so it's cutting across the religious divide, as it were. There
Yes,
is
absolutely. Yes.
no awareness or any information or any knowledge about this disease, about this infection.
Yes. So we have visited Muslim localities in Aligarh. We've spoken to the Hindu community in Aligarh. The common thing that they come out is like the Muslim community says कि Allah भरोसे रहेंगे, the Hindu community says Ram भरोसे रहेंगे, Bhagwan भरोसे रहेंगे. In fact, Jyoti, I'd like to tell you something. I had gone to speak to a couple of people on the road. Like I told you, people were sitting without masks. So when I go to speak to them, they think I'm going to take them for vaccination. So they run away. They say that there is no COVID. Muslims in Aligarh, a few of the, like, the lower middle class and the poor of Aligarh think that vaccination is going to sterilize them. And the Hindus just think that they're going to die with the vaccine. In fact, one of the guys I spoke to from the Hindu community told me that what is the need of the observation room, the 30 minutes observation time after one gets vaccinated? He said that this proves that the doctors and the politicians and the media isn't sure if I will survive those 30 minutes. He in fact came on record and said that only 1% survived from the vaccination.
This is quite amazing, Bismi. And, Aligarh is more like 100, 150 kilometers away from Delhi. So this is really shocking. I think that especially at a center of, such knowledge, the Aligarh Muslim University, and this is how people are talking. But tell me, from the political class or from the university itself, so two parts to this question. One is from the university itself. Is there any sort of initiatives or any efforts to combat this disinformation and to create awareness?
Yeah, absolutely, yes. So after the death of the professors, which happened within a span of like 20-25 days, the Vice Chancellor, Tariq Mansoor, had come up, he had given clarion calls repeatedly and asked people to come vaccinated. So after Eid, and these professors died during the month of Ramzan. It started from 19th until May 16th.
So these are all Muslim? These professors are all Muslim?
Yes. All of them are Muslim professors. So after the Vice Chancellor's repeated calls, what we have come to know is that there's been a 60% rise in, the AMU staff coming for vaccination. And let me tell you, it's not only professors that have succumbed to COVID-19 in AMU. The university has not released an official data on the non-teaching faculty, but what sources have told us is a total death toll, including retired professors, retired faculty, non-teaching faculty members, teaching faculty members, and these professors, the death toll is over 100. In fact, the AMU graveyard, that is primarily only for AMU staff and their family members, there's no place to bury people. They are digging up old graves and they're burying the new dead bodies over there.
How do you know this, Bismi?
Because we had visited the graveyard, the AMU University graveyard.
And did you speak to the caretakers there?
Yes, absolutely. We spoke to the caretaker. There's been a caretaker who has been working there since 2003. And we had also witnessed a professor's mother who had expired from COVID-19, who died from COVID-19 there. And there was a prayer ceremony going on with around 30-40 people. So when we spoke to him, he extensively told us, we are digging up old graves because there's no place left in this Kabristan.
And what about in the city? Are you saying that whether it's municipal councillors or MLAs, are people coming out, or MPs, are people coming out? Because now there is a directive from the BJP that you have to be seen and you have to talk to people and create awareness.
So leaders have now started talking to people. Like the other day, when I was at AMU, a leader, a local leader had come out and he had asked people to come and get vaccinated. Now what, Jyoti, the problem is they started raising this call only after the death of these 18 professors. This was not, this should have ideally been done before that. Because like I said, AMU campus has 2 vaccination centers and has a lot of, people who have already volunteered for the vaccine.
Right.
But in spite of that, these people, so the doctors have told us that we cannot pull people out from their houses and get themselves vaccinated. A couple of people got vaccinated because of the UP government telling them that, we'll not release your salary. It was only because of that.
So if you don't, so this awareness drives are now only after the unfortunate death of these people.
Yes.
What about in Bulandshahr? What about in Bulandshahr, Bismi? Do you find any difference?
So in Bulandshahr, we went to a village called Wazidpur. That has a population of around 3,000 people. Apart from the Asha worker there and her husband and the auxiliary nurse midwife there, who does tikakar and does vaccination for small children. Yeah. Out of those 3,000 people, apart from these 4, no one else is vaccinated. In fact, they are so scared that they are not even getting their small babies, their infants, for getting those injections that an infant gets right after birth, 3 months and 6 months, because they think that they will be given COVID vaccines.
In this part, Bismi, in this part of Western Uttar Pradesh, which has a very big population, I don't know if you went to Deoband. Did you happen to go there?
Sorry. Sorry, Jyoti.
I said, in this part of
Huh.
I don't know, did you happen to go towards Deoband? Do you know if the Maulanas are or from Deoband are any fatwas that are being issued for COVID, against COVID, I mean against the vaccination?
No, Jyoti, we went to Bulandshahr and only to Aligarh. We haven't gone to that side, but we will go. We actually came down to do a story on vaccine hesitancy across Western UP till Mathura and Agra and look at vaccine wastage. We're actually following a story on vaccine wastage because vaccine hesitancy leads also to vaccine wastage.
Right.
One vial has 10 doses, right? So if once you open it up for 5 people and other 5 people don't turn up, the rest of the doses go to waste after 4 hours. So we're basically following that. These are two interdependent things. After that, we'll be moving towards moving deep inside Western UP.
So tell me a little bit about this vaccine wastage. Like you said, one vial has 10 doses. So in these parts, when the jabs, when the number of jabs that people are opening themselves to is so low, then what happens is that do they have to throw it away? Can you reseal the
Yes.
tube and put it back? How does it work?
No, it does not work like that. What happens is after the vial is opened and 5 doses are been given, 5 or 1 doses are been given, the rest of the 9 or rest of the 5 go to waste. So they are stored in an ice-linked refrigerator before they are sent to the district officer, district immunization officer, and then it is decided how it should be decomposed.
So is this happening in Aligarh as well as in Bulandshahr where you have just visited?
Yes. So in Bulandshahr, they told us that district authorities, they told us that this wastage has been reduced by now. So what they are trying to do right now is, if supposedly a person goes to a particular public health center and wants to get vaccinated, but there are only 2 people there. So they do not open the vials there. They send these 2 people to some other center where there are more people so that the wastage is minimized. So right now, as per government data that we have with us, Covishield wastage has reduced to minus 0.4,
What does
which
that
means
mean?
that, so this is negative wastage. The term negative wastage means that when there are, like I said, there are 10 doses in a vial. So sometimes if you handle it properly, these 10 doses can also make up for 11 shots.
Right.
So that 11 shot is a way to save the wastage. Like I said, the term negative wastage. So they are saving those doses.
I see. But this is only for Covishield or is it also for Covaxin?
No, it's also for Covaxin. However, for the government data with us, Covaxin wastage is around 0.58%.
Okay.
Covishield is in minus, is in negative.
There are a couple of comments, not questions, Bismi. Somebody with a very complicated name called dimethyltryptamine 1. Obviously, doesn't know his real name. He's saying that the mutations each need a separate vaccine. But let me just say here that that's not true because
that's not true.
Yeah, that's not true at all because several variants of the COVID-19 virus, whether it's B16172 or B1617, just without without the mutation, we believe, and that's what scientists are saying, that the Covishield vaccine, as well as the other, whether it's Pfizer or Moderna, although those are not now prevalent in our country, but they are well able to deal with the mutations as well. What is your experience and your information on this, Bismi?
So as well, going back to the AMU scenario, the death of the professors, even then the vice chancellor had sent those there was a doubt, there was a panic in the campus that, oh, so many professors have died, this might be a new strain, which was not the case. It was essentially because these professors, now the age group here is very important, Jyoti, because most of these professors suffered from comorbidities. So when they contracted the disease, it got complicated. In fact, 2-3 of these professors had recovered from COVID, but died because of post-COVID complications. There was no new strain. The Covaxin and Covishield is effective right now against the disease. I mentioned the incident of one professor who got his wife vaccinated, right? So his entire family had contracted the disease. His son has told me that my mother had the mildest symptoms even after having comorbidities.
No, but so when you say that post recovery from COVID, then they perhaps pass away from other diseases, whether it's I mean, we don't know what these are, right? Whether it's a heart attack or whether it's blood pressure or diabetes.
Right.
What are the symptoms? What happens? Is there a brain hemorrhage? Is there a heart attack? What happens?
So one of the professors died from a cardiac arrest. The other one developed fever even after testing negative, and then his oxygen level dropped. Was rushed to the hospital, but then it was too late. The others had hypertension, excessive hypertension, and they stopped responding to medication.
But this is post-COVID recovery.
Yes, this is like 3-4 days after testing negative, after the test report became negative.
What are doctors saying? How are they explaining this? That, after recovery, or at least, within a short time after recovery, people are still dying from other complications.
So the doctors are saying that what the doctors right now are trying to focus on is that you should get vaccinated to avoid having harsh or severe symptoms. So what they are telling us is, if you take the shot, the severity of the symptoms will reduce, and the chances of suffering from post-COVID complications also reduces to a certain extent.
Right. So now tell me, Bismi, if there's such high vaccine hesitancy in these parts, does that mean that those people who have taken the first dose are able to take the second dose also in the normal way, that they don't have to wait for 12 weeks or 16 weeks like we see in Delhi now, where there are absolutely no doses?
In AMU, they are giving for 18 plus, they're using Covishield. For 45 plus, they have enough stock for Covaxin because it's again a trial site. In Bulandshahr, where I had gone, they do not have vaccine for 18 plus to 45. They have for above 45. They're giving Covishield. There's no Covaxin stock in Bulandshahr.
So why is it that the Covaxin stock or the Covishield stock from Aligarh cannot be transported to Bulandshahr?
So we tried inquiring about it. We are still following it up, that why is this not the case.
In Bulandshahr, did you feel that the vaccine hesitancy was lower than in Aligarh?
No.
It was about the same.
In Bulandshahr also, if you go deep into Bulandshahr, in rural Bulandshahr is a huge district. There's Khurja, then there's Dharpar, and there are lots of blocks in Bulandshahr. Bulandshahr itself has 93 vaccination centers. But when we visited, I think we visited around 7 or 8 today. There's hardly any crowd.
So what you're saying, Bismi, ties into one of the comments from a viewer called Surinder Tyagi, and he's saying, Madam, it's not just ignorance and hesitancy, but lack of governance. UP is too big to be ruled from Lucknow. We lack governance and the kind of leadership we want. I think he has a point, doesn't he, Bismi, that if UP is such a big state, and like you said, Bulandshahr is such a huge district, and they have 93 centers, but perhaps it's not, it's not sort of devolved down in UP, and are things still much more centralized, and local bodies are not sort of not being empowered to take the decisions, whether it's to go out, speak to people, increase awareness, and things like that. So perhaps that's one of the reasons. What do you think?
Yes, absolutely. That is essentially what is happening in UP. So just by opening vaccination centers, it's not going to solve the problem. You have to walk up to doors. You have to go and convince people to come down. Because again, people in areas like Bulandshahr, a large population is uneducated, is illiterate. Yeah. Awareness, the dialogue is not that much. The dialogue is about fever, it's about bukhar, is what they say. वो बुखार से मर गया, उसका oxygen level कम होके मर गया. So what these leaders, what the system, what the UP government needs to do is like go door to door and convince people to come out and get vaccinated. Because now they think that if I take the vaccine, I'm going to die.
That's right. And
they have to increase the dialogue that vaccine is not the enemy. COVID-19 is the enemy that you need to put up the fight against.
And perhaps if you can find out for us, Bismi, and we can, maybe in the coming days, you can answer this question when we come back to you, has the UP government been speaking to the Maulanas? For example, the Deoband question that I had earlier, because Deoband wields such enormous influence, especially in these parts. Has there been any conversation with their Maulanas, with the Vice Chancellor, for example, of the Deoband, of the university, to say that COVID vaccine it's not that you must be vaccinated or you must be inoculated to reduce the infection, a possible infection. So, we don't know whether that conversation has taken place between the UP government and the. Well, I will let you go, Bismi. There are a couple of comments, so perhaps you can just, Vishwa has a question where he's saying that is this vaccine hesitancy only just for COVID-19, or is it also for other vaccine programs for children? Whether it's BCG or oral polio. What do you think? Is this only for COVID? Then, and if that is true, that there is a general hesitancy, then how does Government of India address that?
So as far as I have witnessed, as far as we have visited the centers, the hesitancy is for COVID-19 vaccine, especially for COVID-19 vaccine. But like I said, because the government is asking them to get vaccinated now, the ASHA workers and the Anganwadi workers, now they have stopped even taking their children to get the normal polio doses and the vaccine. Today we saw an ASHA worker going door to door and asking them, I'm not going to give your child a COVID vaccine. Please give me a child. He needs to get vaccinated.
And Arghyadeep Bharat is asking, what is the role of NGOs? Do you see any NGOs getting into this?
No, not that I have come across, not that I have witnessed.
Because NGOs play a very, very crucial link role between government and people, because they're the ones who know these communities well, and therefore they are like very, very important intermediaries. So surprising that there are no NGOs who are part of this effort to enhance awareness.
Yes, not that I have come across in Aligarh or in Bulandshahr.
Okay, and Kuldeep Solanki had a comment. Your comment, Mr. Solanki, is that our people of metros looking to booking slots in villages to increase their chances to get vaccines. But as Bismi has just explained, that there are enough vaccines going around, especially in Aligarh and in Bulandshahr. It's just that people do not want to be vaccinated. So, so Bismi's message covering Western UP these last several days, especially Aligarh and Bulandshahr, is that all of you who are watching this program, and also please pass this word along to your friends, to your families who are living in these parts. There are enough vaccines going around. So please go out of your houses, go to the centers, get your jabs, because that is absolutely essential in curtailing this infection and creating like a mass immunity. We hesitate to use the word immunity, but people must get out and get themselves vaccinated.
Absolutely, yes.
On this note, thank you so much for your time, for stopping off on the highway. I know you're on the Yamuna Expressway on your way to Mathura, so we will look forward to your stories from Mathura. But keep safe, keep yourself double masked up, and look forward to talking to you soon. Viewers, thank you so much for watching. This is Eyewitness. I'm Jyoti Malhotra with Bismi Taskin. Thank you.
Thank you, Jyoti. Thank you so much for watching us. Thank you.